Hello and welcome to Health Matters on Channels Television. Thanks for staying with us. I am Mary Alale Yusuf. In week 30, reporting, the Nigeria Center for Disease Control recorded a cumulative tally of 867 confirmed cases of Lassa fever, from which 164 deaths have resulted. These figures are more than double those recorded for 2021 at the same time. The case fatality rate, on the other hand, is less this year by 3.9%. Of all the confirmed cases, 30% are from Ondo State, 26% from Edo, and 14% from Bauchi State. Most people affected are between 21 and 30 years old. Men are slightly more affected than women. Lassa fever is an acute viral hemorrhagic illness of 2 to 21 days duration that occurs in West Africa. About 80% of people who become infected with Lassa virus have no symptoms, but 1 in 5 infections results in severe disease. My guest, speaking from our Abuja studio, is epidemiologist and incident manager of Lassa fever from the Nigeria Center for Disease Control, Chioma Danwafo. Thanks for coming to the show. All right, if you can hear me, let me first ask, why do we have so many more cases this year, more than double?
Good morning, Mary. Good morning, Nigerians. I had a bit of hitches with my audio, but I think I can hear you loud and clear now.
This year than last year, we have more than double the number.
Good afternoon. Yes, we have more than double the number of Lassa fever cases as compared to last year. So this is more or less have been attributed to the impact of the COVID-19 pandemic with respect to the health-seeking behavior last year. If you recall, last year was when we had both the second and the third waves of COVID-19 pandemic. So there was that skepticism about going to the hospitals and being termed as COVID cases and then isolated. And also there was the overwhelming COVID-19 response activities that kind of impacted on other diseases, not just Lassa fever. But however, there was testing ongoing and increase in and detection of cases. But it's also worthy to note that we have leveraged on the molecular laboratories that have been optimized for COVID, the labs that we have developed for COVID, for the testing of Lassa fever. So this has also led to increase in number of cases.
So what I'm hearing you say now is that on the one hand, there was the reduction in hospital visits last year, and on the second hand, this year you have more testing capacity. Am I right?
Yes, we have scaled up our testing laboratories, and we are still scaling up. And the thing is that the more laboratories you set up, the more cases we detect. And there's also improvement in surveillance activities in terms of active case finding. Healthcare workers have been trained for detection of Lassa fever. So that index of suspicion is improving, and more cases are being detected. We have also tried to intensify risk communication activities to inform Nigerians as to what to look out for, to have that high index of suspicion when patient presents. If they test positive for malaria, that healthcare workers should begin to think Lassa.
Okay, before we go into what people should look out for, let's quickly clarify something. 80% of people who get Lassa fever actually recover. They probably don't even know they had Lassa fever. Just clarify for us, because people are thinking, this disease is with us anyway. Can they be treated at home? Should people treat themselves at home?
So Lassa is endemic in Nigeria, and like you had mentioned, discovered over 50 years. It's been 53 years now and counting. And yes, 80% of the cases, from what we know, are asymptomatic. So they may run the course of the disease and may not even know that they were ever infected. But then we have the 20% that are quite acute and can also be fatal. Lassa is not a disease like COVID that have the home management option. So for every Lassa fever case that is identified, so once a case is suspected, sample is collected and taken to any of the Lassa fever laboratories in the testing network. Once it is confirmed, that case is immediately isolated and managed in the designated treatment center. We have over 22 treatment centers across the country. We also have centers of excellence in management of Lassa fever, such as the ERA Specialist Teaching Hospital and other hospitals across the nation for management of Lassa fever. Because for Lassa fever, early diagnosis is key for survival. Because
okay, so
if you're able to initiate treatment on time.
If I can jump in, that's where I want to go to. You spoke about an index of suspicion. So what are we looking for? What should make us suspicious and come to the hospital or ask for help?
Lassa presents mimics other febrile illnesses such as malaria, typhoid. So initially, the patient could present with fever, headache, body ache, malaise, sore throat. So at the point the patient is already bleeding from the orifices, that's from the nose, from the mouth, from the ears, it's already at the terminal point of the disease, and I mean the prognosis is quite poor. So what we always advise healthcare workers is to be on alert. So if you have managed a patient for malaria and that patient is not responding, you have tested for malaria, is negative, and you've ruled out COVID, you've ruled out other febrile, you start thinking Lassa fever. Contact your disease surveillance officer, get the sample collected, isolate the patient, get the sample tested, and once the result comes out positive, then we initiate treatment. Early survival is key when it is detected early, and treatment is commenced immediately.
If you suspect you have malaria, just go to the hospital, because it could be anything.
Yes, so that's our advice. We discourage any form of self-medication. So if you suspect it's malaria, present to the nearest health facility, and a proper test will be conducted. If malaria is ruled out, then we can start thinking of Lassa fever or other diseases.
Okay, how do we discourage or stop transmission of Lassa fever?
So Lassa fever first is an acute viral hemorrhagic fever, and is transmitted from rodents. About 80% of the cases are transmitted from rodents to humans. So the Mastomys natalensis is the reservoir that has been is the most commonest reservoir for Lassa fever. But then other rodents have also been implicated to carry this the Lassa virus. It's transmitted when humans come in contact with infected rodents, either their feces, their urine, or their blood. So either this is contaminated via, if the food or drinks are contaminated, and then you consume it, you can be infected. However, there's also human-to-human transmission. Human-to-human transmission occurs when you come in contact with someone who is infected with the virus, either the body fluid of the person, and here healthcare workers are mostly at risk, and also caregivers of patients who are infected. So that is why we always advocate for healthcare workers to adhere to standard precautions at all times. That's infection prevention and control practices, because it could be Lassa. It may not always be malaria. At every point, irrespective of what your initial diagnosis is, whatever it is you're thinking this patient have, always protect yourself, always adhere to standard precautions. So that's by wearing your personal protective equipment so that you protect yourself and also protect other patients.
Okay, so you advise healthcare workers because of the likelihood of getting Lassa fever in the hospital setting. What would you tell a patient? How would you ask a patient to, an unsuspecting patient who probably comes with something else, how would you advise that person to behave in the hospital environment?
So for patients, when they come to hospital environments, it's very important that you also, perform hand hygiene. We have had a lot of gains in the ongoing COVID-19 pandemic. So we now have hand hygiene stations. There are the hand sanitizers in the different stations in the hospital. So ensure that you practice personal hygiene by always washing your hands and always washing your hands with under running water and with hand sanitizers when available. So just if you're in a crowded place, if possible, ensure you maintain that distance from other patients so that you do not get infected with, I mean, aside from Lassa, it could be COVID, because we are still in the pandemic. And we are still reporting cases as of today.
We're told that case fatality rate is generally 1%. But with the current occurrence, I wouldn't want to call it an outbreak, we have 18.9%. What's the explanation for this? Has this disease evolved over time?
Yeah, so in the past, we've had case fatality rates of over 80%. Then we came down to 50 to 30, and currently we're at 18. Our goal really is to have a less than one-digit case fatality rate, and that's why we're developing the Lassa fever 5-year strategic plan. So this is like a roadmap to help us better control this disease. So it's a One Health strategic plan that will involve other ministries, because it's also important to know that the Ministry of Environment and Agric have very key roles to play in the prevention of this disease, given the mode of transmission. So we are currently at 18.9, like you mentioned. We are not where we want to be, but I mean, we are also not where we used to be. There has been a lot of investments in terms of the case management, because the case fatality rate is really because of late presentation. Because at the point the patient has gone from one pharmacy to another, eventually presents to the hospital, is already late. So most times the case fatality rate is as a result of poor late presentation. And by the time treatment is initiated, it's quite late, and we lose the patient. So what we advise is, and also for healthcare workers, to have that high index of suspicion, because if they're able to suspect early, they can collect the samples early, we get the samples tested, and if the result comes out positive, treatment is initiated early. There's been a lot of investments in case management. We've designated treatment centers. Healthcare workers have been trained in collaboration with our partners like WHO, and our treatment centers like the IST, ERA Specialist Teaching Hospital. So these are like centers of excellence that have healthcare workers with a wealth of experience that have managed Lassa fever cases over the years. So in the past, when a pregnant woman presents with Lassa fever, the baby is immediately, the fetus is immediately, aborted, terminated. But now, given the experience they have had over the years, they've been able to modify the regimen, and it's no longer a death sentence as before. So now they have successfully managed Lassa fever cases in pregnancy over the years. So these are some of the success stories that we are sharing. learning has been evolving. We have developed Lassa fever case management guideline, which has been translated to other languages to be used in other West African countries where Lassa fever is being reported. Because Lassa is a disease that is endemic in West Africa, with Nigeria bearing the highest burden, and Nigeria also being the country where the disease was first discovered in 1953.
I must say kudos to you for that. That's really remarkable news. But we'll go on a break right now. When we come back, we'll continue the discussion. Stay with us. Welcome back. We're talking about Lassa fever on Health Matters, and that's on Channels Television. 0808-054-2233 is the number you should call if you have questions on Lassa fever. You can also tweet at CTV_Mary A. And my email is moalale@channelstv.com. We are having a discussion with Chioma Dan Mwafo, who is the incident manager for Lassa fever in NCDC. Now, 1 in 5 cases might become serious. Let's just say that these serious cases are treated, and they recover. Does the disease leave anything behind, any marks, any disabilities or stuff like that?
So in some survivors, we have seen sequelae that present like in form of hearing loss. So some have lost both ears, some could be one ear, partial deafness. So this is one of the key sequelae of Lassa fever. And we know that also impacts on the quality of life of the survivors going forward. What some centers also do is to have a survivor network where the different survivors meet, interact, and they also provide some kind of supportive psychosocial support for them going forward.
Okay, so let's go to something a bit different. Just in the last week and a few days, China discovered a new virus called the Langia henipavirus, spread by the shrew, which is a rat. Do we have these rats here? And what do we know about this henipavirus?
The henipavirus is emerging, is new from what we're told. And for the rodents, I mean, we have different rodents here in Nigeria. But if it's currently in circulation, that animal surveillance by the animal sector will tell us. But I think there are ongoing research to find out if this virus is in circulation. But meanwhile, I think the important thing is that we are prepared. A lot is happening. There are lots of emerging and re-emerging diseases which can present in any form. The world is a global village. People are traveling from one country to another. So we all need to be on alert and also to set up diagnostic capacity to be able to detect this virus in case in the event that it comes into the country. So that's what we are doing, working hard to support the existing molecular labs. And like I said, one of the gains of COVID is that it strengthened our diagnostic capacity as a country. Now we have molecular laboratories all over the countries, in all the states in the country, that have the capacity to detect any of this virus.
Let me cut in there to take a call from Ada. Ada, what's your question? Welcome to the show.
Hello, good afternoon, or good morning. I'm calling from Jos State. And it's unfortunate that Lassa is still with us because of non-observance of personal and environmental hygiene.
I didn't quite get that.
Pardon, I said, my question is this. Can one get it by eating bush meat, including rats or bush rats, whichever? And then if not, I mean, yes. Is it possible? Is there a way the person can cook that rat and will not be able to contract it? Some people eat rat.
Thank you, Ada. I'll let I'll let the chairman answer that question. So some people are not leaving this rat menu. They are looking for a safe way to eat rats. Please take it away.
So we know rat is a delicacy in some places, and I mean, what we always advise is, just avoid handling of rodents. Any form of handling, because the risk is really much, especially in the processing. So when the hunter, hunts and brings this rodent back to the house, it's the housewife most times that processes it. If we say wear personal protective equipment, you may not have access to that personal protective, and you may not also know how to properly use the personal protective equipment. So I think to be on safe side, avoid handling of rodent of any form, because you do not know which of this rodent is infected with the virus.
Okay, we're getting a call from Issa in Kebbi State. Hello, Issa. What's your question?
Yes, I said good afternoon.
Good afternoon, Issa.
Hello, I said I want to ask a question.
Go right ahead.
Okay. I said I just want to know the prompt areas in Nigeria that they are prompt to Lassa fever.
Areas that
so
are
that
prone
maybe,
to Lassa
maybe
fever.
if there is any, yes, if there is any, can do, because I just want to know. That is the question.
So I will let Ms. Dan Wafo answer that question. Who is prone? What areas are prone to Lassa fever in Nigeria? What do we do about it?
Okay, so everyone is at risk of having Lassa fever once you come in contact with the virus, either through rodents that are infected, contaminating your food or your drinks, or coming in contact with someone who has the virus. And for the prone areas, we've had cases reported from all the states in Nigeria, in as much as we have states that are termed to hotspot states like Edo, Ebonyi, Bauchi, Ondo. But this virus is in circulation in every state, because we have had reports from all the states. And the message is, wherever you are, keep your environment clean, practice personal hygiene, ensure that any hole that is in your house is blocked so that these rodents do not have access to the houses. And also avoid bush burning, because it tends to displace them from their natural habitats to the homes. And above all, if you have any symptom, if you're sick, please go to the nearest health facility and you'll be tested. If it's Lassa fever, you'll be immediately isolated and treated.
We're having Mike. Hello, Mike. What's your question?
Yeah, my question is, can we get Lassa fever from eating of grass cutter?
Okay, we're back to bushmeat.
Yes, bushmeat.
Can we get Lassa fever from eating grass cutter? Grass cutter is a real delicacy.
Yeah. Thank you.
Please take it away, Ms. Wafo.
Yeah, grass cutter is a delicacy. Like I said, the virus is harbored by rodents, mostly the mastomies, and then other rodents. I think it's been found also in Rattus ratus. We are very kind of skeptical about saying eat this or do not eat this, because there is evolving science. There are lots of animal surveillance studies going on to see which of these animals harbor this virus. I mean, aside from Lassa fever, there's also monkeypox. There are some of these zoonotic diseases that are coming up that are harbored by this, that are reservoirs in these animals. So it's really to be careful, and like I said, just avoid handling of this rodents, because the risk is in the processing, the risk is in the handling, the risk is not necessarily in the consumption. the end user. So when you are eating one that is already being prepared, that's really not where the risk is, especially if it's well prepared, or is in the processing, is in the handling of the bushmeat.
Thank you so much, Choma Danwafo, Incident Manager, Lassa fever, NCDC, and congratulations on your new biorepository in Lagos. Thanks for coming to the program. And thank you at home for being with us and asking all those wonderful questions. Have a lovely day. I am Mary Alale Yusuf.